Meantime, the COVID-19 numbers still showing an upswing with 31 additional cases on Monday. 22 of them are out of Grand Bahama and 9 here in New Providence. This pushes the country's COVID-19 count to 679. This growing trend not sitting well with health officials as they continue to appeal to residents to do all they can to help curb COVID-19. Lloyd Allen speaks with the Deputy Chief Medical Officer, Dr. DeLon Brennan, on COVID discoveries.
The cases that we're seeing in country now are really more attributed to a what looks to be not just related to travel, and then we saw a spread from travel to those who were in the same households as those who may have traveled. And now we're seeing more cases that are coming up related to workplace exposures, social exposures. So we're really seeing more happening around clusters and a movement toward community spread as well. And unfortunately, given that that's what we're seeing now, we had to look at recommending other measures in order to help us to control that.
And speaking about those recommendations, New Providence set for a 2-week lockdown that announced by the Prime Minister, the Most Honorable Dr. Hubert Middens, yesterday. He said, quote, "There's been an exponential increase in the number of cases, an increase in hospitalizations, and an increase in the demand for ICU beds, and sadly, an increase in the number of deaths. The more cases that present to health institutions, the more services will be needed." How critical are resources at this point?
So we are seeing our resources reach their capacity when it comes to how many persons we currently have in our institutions. We're also seeing, in places where we didn't necessarily have services before, we're having to open up additional services. So, the retrofitting of the South Beach Health Center to be able to take care of inpatient admissions, having to use, a private-public partnership with Doctors Hospital to use Doctors Hospital West to expand our capacity, not just for inpatient, but also for intensive care unit capacity as well. We're doing the same thing in Grand Bahama. We're using the Cancer Association building, other partnerships that we can put in place. So we're stretching not just what we had already in the Princess Margaret Hospital, Doctors Hospital, San Antonio Rehabilitation, and the like. We're actually moving to other facilities to be able to take care of it. So when we reach those capacities, even expanding our capacities, it definitely is a strain on the system.
Now, you talked about additional beds in Grand Bahama, but that island has also been under a 2-week lockdown for some time. What developments happening on that front?
So what the lockdown in Grand Bahama is allowing us to do is get our hands around all of the contacts of the original cases, and then find others who may be symptomatic, those who are finishing up their quarantine, getting them tested as well. So I think the same thing, we expected is exactly what's going on. We're getting our hands around the situation, but in doing so, the more testing you're going to do, the more contacts you find, the more symptomatic individuals you're going to find, those case numbers will continue to grow. We are, the good thing about it, what we're seeing right now is we're starting to see a slowdown in the number of individuals that are presenting to the emergency department for, that are really ill and have, really intense disease. So that's a good sign, but, we are far from comfortable because this is still early in those activities. So I don't expect, even with the lockdown that happened in Grand Bahama, for us to really see the benefit of that for another 2 to 3 weeks easily.
Wow. Now, additionally, what are officials hoping to accomplish across the country over the next 2 weeks? This in line with the Prime Minister's announcement for a 2-week lockdown nationwide?
I think the same thing that we saw in the original wave that we had in country, when you consider between March and say late June, is the approach that we are hoping to be able to accomplish. We want to be able to track down all of the cases, all of the positive individuals that are out there. We want to be able to find out who their contacts are. We want to get into those homes, get into those workplaces. We want to really be able to clean up the situation that we currently have, because we're just accumulating cases at such a rapid pace currently that it doesn't allow us to be able to really contact trace everyone with the expediency that we were before. So we're bringing on additional people, training them. But if you're just running behind the epidemic and the outbreak, then you won't have the ability to really train people to be able to do the work. So it's, trying to fix the car while you're driving it at the same time is a lot of, we just haven't had the chance in this new setup for us to be able to ramp up our capacities as quickly as we would like. So the shutdown allows us to be able to do that, to really address the issue, stem the tide of how quickly we're accumulating new cases, and then ideally we'll be able to sort of flatten out that the case accumulation and how fast we're getting them, with a hope that over, again, the next 3 weeks to a month, that we start to really see the slowdown and the improvement showing up because of the interventions and the lockdown that's happening.
And another important component, we talked about it a few weeks ago, the importance of testing. You talked about a new slate of persons being tested, rather trained at the University of the Bahamas. How are those efforts going in increasing your ability to test more people?
Going very well. I think you can see from our testing numbers that, we're definitely increased that ability. We brought on some, doctoral level persons, some master's level persons, some bachelor degree level persons from the university and others and other places as well, for us to be able to move through our ability to extract DNA or extract molecular material from our swabs. We also have an increase in the number of places where testing is being done. So, that's definitely ramped up our ability to do, this testing. So, with our need that came along, where we were seeing more persons present, we had individuals coming from other countries that were high burden. So we had to have a different approach and an increased level of testing going on. But like I said, with that increased level of testing, it's an increased number of persons and capacities needed as well. So even though we've picked it up, we're still trying to add more capacity so that we can do it even faster.
Well, as you stated, a busy few weeks ahead. Thank you so much again, Dr. Brennan, for your time.